12 life hacks that can help you survive. In an emergency situation, the first thing that comes to mind is the advice of your friends or your family. However, sometimes even the most well-known and popular recommendations turn out to be wrong and harmful. Did you know applying ice to a bruise is not the best idea? And lifting up an unconscious person might lead to severe consequences. Here are the 12 dealing with a foreign object in the eye. First things first, if there's something in your eye like a piece of glass, don't do anything yourself. Have dealing with a foreign object in the eye. First things first, if there's something in your eye like a piece of glass, don't do anything yourself. Have someone drive you to the hospital. If the object is just an eyelash, then don't forget to wash your hands before you do anything. Try to locate the eyelash by looking in a mirror. Blink to make your tears wash the eyelash out. Once the object is in the corner of your eye, take a wet piece of cloth and use it to remove the eyelash. Number 11. Applying ointments to a wound. Ointments contain unwanted moisture, which is a great environment for bacteria to reproduce more quickly. The best thing you can do is clean the wound in cool water with soap and put a dry bandage on it. You will see that the wound will heal more quickly. Number 10. Rubbing a person with a fever with alcohol or vinegar. Vinegar and alcohol are absorbed into the blood, so it's kind of a way to get drunk or to make a wacky salad dressing. Seriously speaking, alcohol rubbing may create intoxication, while vinegar will significantly raise acidity, which is especially dangerous for children. So don't believe these outdated pieces of advice. Drink a lot of water, tea, and other non-alcoholic fluids. Cool the air in the room to a temperature of 61 to 64 degrees Fahrenheit, or from 16 to 18 degrees Celsius. In these conditions, the patient will get over the fever by themselves. If they don't, they should see a doctor. Number 9. Lifting up an unconscious person. If someone faints, you have to lift them up and sprinkle some cold water on them, right? Well, that's what most people think. Like this video if you thought so. However, lifting a fainted person up will only aggravate the spasm. What you should do is lift their legs up, unbutton any tight pieces of clothing, and don't let them stand up right after they come around. After they regain consciousness, don't let them drink coffee or energy drinks that many people love. Caffeine will only lead to dehydration. Number 8. Treating burns with butter or sour cream. Many people believe that this method is effective only because it relieves pain. But why do butter and sour cream make you feel better? The thing is, we keep them in the fridge, so when we put them on a burn, they're cold. The danger is, though, that butter and sour cream dry your skin and disrupt thermal exchange. This results in heat having nowhere to go but deeper into the skin, causing even more damage. What you should do is hold your hand in the cool water for 15 minutes. This will help with the pain. Do you know why blisters appear on the burn spot? In our bodies, everything happens for a reason. Blisters protect the wound from infection. Removing the protective layer may lead to festering. Number 7. Setting a bone on your own. Are you a professional trauma surgeon? If not, you should never set a dislocated joint on your own, no matter how cool or brutal that looks in the movies. It may result in additional injuries and the resulting litigation. The best course of action would be to immobilize the injured limb and go to the hospital as soon as possible. Bandage the limb in a comfortable position, immobilizing not only the place of possible fracture, but also the two closest joints as well. Number 6. Applying warmth to a sprain. When your muscles are sprained, a warm cloth won't help. On the contrary, heat will strengthen the blood flow, leading to a more severe swelling. In the first days after the injury, apply cold. It will lessen the inflammation and kill the pain. Try to use the sprained limb as little as possible for at least the first 48 hours.